An enormous welcome to all of you. I am Vaishnavi, student of BMS first year 2018-19, pursuing my medicine from Shri Ram Ayurvedic Medical College and Hospital, Meerut. I would like to draw your attention towards my topic, anatomy of liver. Now let's know more about the liver. First, the liver is also called hepar, that means hepatic. Secondly, the liver is the heaviest or the largest gland of the body. Thirdly, after skin, it is the largest organ of the body also. Fourthly, it secretes bile and performs various other metabolic functions. Let's talk about the physical aspects of liver. First, shape. It is wedge shaped. Second, color. In living subject, the liver is reddish brown. Third, weight. Weight differs in males and females. In males, it is of 1600 gram and in females, it is of 1300 grams. Let's study about the situation of liver. First, it is situated in the right upper quadrant of abdominal cavity. It is also situated in whole of right hypochondrium, greater part of epigastrium and extend to left hypochondrium. Most of the liver is covered by ribs and costal cartilage. Now we will look over the external features of the liver. Firstly, it has 5 surfaces: anterior surface, posterior surface, superior surface, inferior surface and the right surface. Anterior, posterior and superior surface are combinedly known as diaphragmatic surfaces, while the inferior surface is also known as visceral surface. Secondly, it has 3 borders: superior border, inferior border and the right border. Now we will see the divisions of liver. The liver is divided into 2 lobes. First one, the right lobe, second one, the left lobe, by the attachment of firstly anterior and superiorly through falciform ligament, inferiorly through fissure of ligamentum teres, posteriorly through fissure of ligamentum venosum. Now let's look upon the right lobe. First, it's much larger than the left lobe. Second, it forms the 5th, 6th part of the liver. Third, it contributes to all the 5 surfaces of the liver. Fourth, it presents the caudate and quadrate lobes. Now about the caudate lobe. First, it is situated on the posterior surface of the liver. Second, it is bounded on the first right side by the groove of inferior vena cava. Second, left side by fissure of ligamentum venosum. Third, inferiorly by the transverse fossa of porta hepatis. Fourth, superiorly, it is continuous with the superior surface. Now, let's talk about the quadrate lobe. First, it is situated on the inferior surface of the liver and is rectangular in shape. Second, it is bounded by first anteriorly by inferior border, second posteriorly by porta hepatis, third on the left side by fissure of ligamentum teres, fourth on the right side by the fossa of gallbladder. Now let's understand what exactly porta hepatis and left lobe means. First, porta hepatis. It's a deep transverse fissure about 2 inches long. It is situated on the inferior surface of the right lobe of the liver. It lies superiorly to the caudate lobe and inferiorly to the quadrate lobe. Now about the left lobe. It is smaller than the right lobe and forms the 1/6th part of the liver. Now let's understand the relations of the liver. First, peritoneal relations. Most of the liver is covered by the peritoneum. The areas not covered by the peritoneum are as follows. First, a triangular bare area on the posterior surface of the right lobe, limited by the superior and inferior layer of the coronary ligament and by the right triangular ligament. Second, the groove for the inferior vena cava on the posterior surface of the right lobe of the liver between the caudate lobe and the bare area. Now let's talk about the visceral relations. First, anterior surface. First point, the surface is triangular and slightly convex. Second point, related to xiphoid process, diaphragm on each side. Falciform ligament is attached to this surface. Second, posterior surface. First, it is triangular. Second point, it is deep concavity for vertebral column, right suprarenal gland, caudate lobe, ligamentum venosum. Third, superior surface. It is quadrilateral and shows a concavity in the middle. Fourth, inferior surface. It is quadrilateral and is directed downwards, backwards and to the left. Sixth, right surface. It is quadrilateral and convex, related to the diaphragm. Now let's understand the supplies of the liver. First, atrial supply. 30% of the branch of celiac trunk receives supply from the right and left hepatic artery and 70% receives from the portal vein. Now let's talk about the venous drainage. Hepatic vein drains into inferior vena cava. Now let's know about the lymphatic drainage. Lymphatic drainage of liver is first celiac lymph nodes, second hepatic nodes. Now let's understand the nerve supply of the liver. First sympathetic nerve through hepatic plexus, second parasympathetic nerve through vagus. Now I would like to conclude my PPT by sharing the applied aspects of the liver. First, hepatitis, that is also known as inflammation of liver or viral infection. Second, cirrhosis of liver, in which liver tissue undergoes fibrosis and shrinks. Third, hepatic coma, also known as liver failure. Fourth, tumor of liver, also known as hepatoadenoma or hepatocarcinoma. Fifth, percussion. Sixth, biopsy. Seventh, trauma. At last, I would like to thank all of you for listening me. Thank you so much.